Can an X-ray help you determine whether or not you need a hip replacement? I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. When it comes to hip pain, X-rays are one of the most common medical tests. When you go to an orthopedic surgeon, they're always going to get X-rays if you have hip pain. But what do those X-rays actually show? How can X-rays actually help you get better? In this video, we're going to talk about ways X-rays work and what they can show you about your hip. X-rays can demonstrate the presence of osteoarthritis. Now, I've talked a lot about osteoarthritis. It's the most common form of arthritis. It affects over 32.5 million people in the United States, according to the CDC. It's a degenerative joint disease causing pain, stiffness, loss of mobility in the joints, like your hips. Usually the symptoms start gradually, mild to moderate discomfort in your hip. Discomfort a lot of times is worse at night or after a lot of activity, but you can usually still function normally during the day without any significant limitations on your ability to work or perform daily activities like cleaning your house or walking around, unless there's other factors going on. But as the arthritis progresses into more severe stages, it can make it difficult to walk up and down stairs, to get into bed, because your hips and maybe your knees too get stiffer and stiffer. The X-rays and other imaging studies are used primarily to diagnose the arthritis, but also to rule out other causes of pain that could be going on. Things that show that, hey, maybe this is something else. Maybe you need surgery, maybe that you don't. Now, if your doctor suspects that you might need a hip replacement, he or she may order X-rays to determine whether surgery is necessary. X-rays can be used, like I said, to rule out other conditions like fractures and other things going on. What X-rays can't do when you're talking about hip pain and hip arthritis that could need hip replacement is they can't tell you what the cause of your pain is. And what I mean by that is, yes, the X-rays can show you have arthritis in your hip, but that doesn't mean the arthritis is necessarily causing your pain. X-rays and other imaging studies like MRIs may show you things that could be painful, but necessarily not how much of that pain is. One example, and there'd be a lot of these, maybe you have bone spurs in your spine, early degenerative conditions in your spine. Doesn't mean necessarily that's where your back pain is coming from. And that applies to pretty much anything as far as X-rays go. Now, a lot of times when you go see an orthopedic surgeon for hip arthritis, they'll get the X-rays and they'll say, hey, you do have arthritis. Does this necessarily mean you have surgeries? X-rays are a very good starting point for that diagnosis for the arthritis because it's simple and it's a non-invasive test. But they don't always and really shouldn't determine whether or not you need a hip replacement or some kind of other joint replacement if it's another joint. And by that, what I mean, if you have arthritis, say of the hip, X-ray can show wear and tear of the bones and cartilage, maybe little pieces of bone in the space of the joint, but you might not have any pain at all. I've seen that fairly frequently. I actually had a set of twins one time. They were in their 60s and they were both patients of mine. One had much worse knee arthritis. I know we're talking about hip arthritis, but much worse knee arthritis than the other twin did. But the one whose X-rays didn't look as bad had much more pain. So X-rays, again, it may not be the source of pain at all, or it may not correlate to how bad the symptoms are. So if you're experiencing pain, the X-rays are important, but it's important to get a proper diagnosis for your doctor. Pain's subjective. It's felt differently by different people. And pain can be caused by a lot of different things. Arthritis of the hip is one of the most common causes of hip pain, but it's not the only condition that causes hip pain. So it's important to find out if that osteoarthritis seen on your X-ray is actually the cause of your symptoms. And then that is involved in making the diagnosis of, or the decision as to whether or not you potentially need a hip replacement. Again, X-rays and MRIs too do not determine exactly what the cause of your pain is. And that alone, that test is not all that you need to determine if surgery is needed. If you want to find out if you need a hip replacement, you get examined by an orthopedic surgeon that asks you about all your symptoms, does a physical exam in addition to those imaging tests before talking about treatment options. I'd love to hear about your experience with your hip injury. Leave those in the comments below. Just understand, I can't offer you medical advice, but I will try to answer your question in a future video. Make sure to subscribe to my channel to be notified and click the bell to be notified when I release a new video or when I start my next live stream, including my Ask Dr. Geier live shows. Thank you for watching. I look forward to helping you feel, look, and perform better than ever.